Hi, I'd like to talk to you about tear trough rejuvenation using fillers and other non-surgical modalities, as this is one of the commonest concerns patients present to me with at my Harley Street clinic. So restoring the tear trough naturally can be quite challenging because every tear trough ages differently, but I'd like to summarize the key factors or the key aging changes that occur in a tear trough. There are skin changes, and the skin is becoming thin, crepey, wrinkly, and pigmented. There are soft tissue changes, so that means we're losing the fat just under the skin so that the underlying deep fat pad becomes visible, therefore you get an eye bag. And we're also losing fat at the lid cheek junction. So those are the changes occurring in the soft tissues. And finally, there's a change occurring in the bone. Yes, you heard me right, you're losing bone on your anterior cheek, and you're also losing bone in your eye socket. So your eye socket is becoming bigger as you get older. So let's talk about the common concerns. Under eye dark circles or looking tired is often just because of the volume loss that I talked about, and the volume loss can be in the skin or in the soft tissues, and it's simply restored by injecting filler and placing the filler where the volume was originally lost from. It's a painless procedure as we put numbing cream under the eye, and it takes about 10 minutes to perform. But you can be a little bruised and swollen after the treatment, so it's always wise to plan some time around these treatments rather than just rushing into it before a big social event. So fillers are an instant fix for under eye dark circles that are caused by volume loss, the deep volume loss that I was talking about. But if your dark circles are caused by pigment, and we often see this in ethnic skins, in darker skin types, particularly the Hispanics, the Indians, the Middle Eastern patients, then we need to embark on a skincare plan that's also going to treat the pigmentation. And very often I will give you some advice, and we have a specially formulated under eye pigment recovery kit with certain creams and lotions and potions that help brighten the under eye and resolve the pigment. A common question I get asked is, how long is the filler going to last? So I always tell my patients that the filler lasts anywhere from 6 months to a year and a half, and most patients come back between 6 months and a year, and they'll see me and we put in a small amount of filler so they get good longevity out of it. Whenever a patient has a tear trough filler with me, it is forming a bond. We are there to support you and look after you after you've had the filler. It can be quite a daunting experience for somebody who's never had fillers, and I recommend that you go to my website and have a look at all the information we have there for you so that you can clarify the journey, and you can also see what happens in the recovery phase. We've also created a special recovery kit. This is a kit that I give my patients, and I recommend that you use to improve your healing and shorten your recovery period. So I hope this little video has answered your concerns about having tear trough fillers. If you have any further questions, please don't hesitate to get in touch with the Perfect Eyes Limited team.